Growing up, I used to have really thick hair. In fact, I hated it that it was so thick. About 15 years ago, I was losing a lot of hair. It was in the shower, coming out in clumps. I would have to empty my brush constantly. I was like shedding like a dog. I was under a lot of stress. I totally think that the stress contributed to my hair loss. Got it layered recently to make it a little bit thicker back here, but you can still see it's hard to hide the temple. My question is there anything I can do to stop my hair loss and boost the thickness?
We invited Joanne here today to meet with hair restoration specialist, Dr. Alan Bauman. Thank you both for being here. And we have you here to talk about solutions, but first things first, let's just talk about hair loss and why it happens.
Yeah, and you know, it's very important to understand that there's a big difference between the way men and women usually lose their hair. If you look at the animation, with men, hair loss typically tends to start around the back of the head, and it's very, very common then to see the loss up in the temples. But that's what we call the male pattern of hair loss. With women, it tends to be around the scalp, so you see a widening of the scalp, but you can also sometimes see hair loss in the front by the temples. I see this a lot in women in my practice, and it is so upsetting. But I think it's important to understand, you mentioned you were under stress. Day-to-day, daily average stress shouldn't really make you lose a lot of hair. We'd all be pretty much bald if that were the case. But big hormonal changes, some vitamin deficiencies, thyroid problem, and then of course things that you do yourself to your hair, styling and coloring and things that you're mechanically doing can also play a role. But I normally tell women that if they gently pull on their hair, it's normal to see a couple of hair strands come out, up to about 10. To lose about 150 strands of hair in a day can be normal. When you start to see big piles of hair on your brush like you did, Joanne, or in the drain, that's when it can be helpful to see either a dermatologist or a hair specialist.
And really what we're talking about here is the importance of the hair follicle, right?
Yeah, that's right. So in my practice at Bauman Medical Group, we've treated thousands of patients over 17 years with medical therapies like prescription medications, injections like platelet-rich plasma and stem cell therapy.
All for hair.
Hair transplantation in severe cases, and of course, low-level laser therapy. That's what we're talking about today. We have portable devices that literally fit underneath your baseball cap.
So no one would even know that you're wearing these lasers that are helping you restore your hair, and it can be under a beautiful, fashionable hat.
That's
correct.
amazing.
So the laser cap contains 224 laser diodes that deliver the same clinical dose that we would normally give in the office. And so patients can use that at home, you know, while they're watching TV, walking the dog, driving in their car.
Totally. So Dan, I want you to watch this. We're going to show you on this medical wall what Dr. Bauman's talking about, because this is exciting stuff.
Yeah, so everybody in their teenage years starts out with a thick, full, healthy head of hair because the follicles are producing thick, shiny, good quality hair fibers over time. But because of heredity and other factors, social factors, environmental factors, these follicles can shrink and wither. And what happens is that you miniaturize these hairs. So with laser therapy, we can use this is a non-chemical, non-invasive way to stimulate cellular metabolism. So this light energy is converted at the level of the follicle, the cellular level, and these follicles are going to get thicker, stronger, and healthier over time.
And it's an additional treatment to, you've talked about the pharmaceutical treatments, et cetera. It's treating the hair follicle in a different way.
Right, and I also recommend, you know, for you at home, you can try biotin. There are some over-the-counter hair growth topical treatments that can be very effective. You just have to remember to change your pillowcase every night if you're going to use them so that hair doesn't grow on your face where you don't want it to grow. But the best news, Joanne, and we'll actually have more of those tips for people on the website about ways that you can stimulate hair growth. It is important to remember, as I'm sure you tell all your patients, Dr. Bauman, it can take up to 6 months to see changes in the hair growth on your head because of the life cycle of a hair follicle.
Right,
The best news for you, Joanne, is you are going home with one of Dr. Bauman's laser caps.
Thank you.
You're welcome.
And I think we have some before and after pictures so you can see what to expect. I mean, the results are pretty impressive.